Happy Tuesday. Time for Tidbit Tuesdays. So this week, there's been a lot of things in the news lately, the last couple months, about United Healthcare, pre-authorizations, and denials. I want to talk about pre-authorizations. So most insurance companies, if you're going to have any kind of procedure done, other than your routine doctor visits, stuff like that, you need to contact the insurance company or have your doctor contact the insurance company and do a pre-authorization. So the pre-authorization is supposed to accomplish several things. The first thing is it verifies your insurance is active with the provider, that they're in network, and what your expected cost is for that procedure. This way the doctor knows how much to charge you, and you know if they're not network or in network. Hopefully they already know this ahead of time, but it's a good way to know all those details going into it so you're not blindsided. And I say that it's supposed to do that because sometimes when you call the insurance company, you get misinformation, or the doctor's office doesn't know how to code something correctly, and you're getting the wrong answer from the insurance based on the wrong information that the doctor's office is providing. I had a case of that recently where screening colonoscopies are covered 100%, but yet the doctor's office insisted on coding it as a surgery, which it could be if there's a polyp, but you don't know that until you do the procedure. And insurance was trying to say that it's going to be covered. There's a 90-day waiting period for elective outpatient surgery. Well, this is not elective outpatient surgery. It's a screening for colon cancer. So that's a whole big rigmarole if the doctor's office is perhaps coding things incorrectly. I'm not going to blame the doctor necessarily here because I don't know all the background, but this is why it's important to find out, because if the doctor's coding it wrong and upcharging so that they can collect more from you, that's a big no-no. So that's one way to find that out. The other reason is that there's less chance of denial from the insurance company if you get the pre-authorization, because you know if they said they're going to cover it, and if they say they're not, then you can appeal it. And there's instances where maybe they do have to cover something where they don't have all the information, or again, the doctor's office didn't provide the correct information to the doctor. There's a story on TV the other night about that a couple used AI to write an appeal letter and got the pre-authorization approved. So as annoying as this is, there is some advantages to you as a consumer for following these steps. And it's to save you money in the long run. The insurance company is doing it for their benefit because they're hoping not to pay out a claim. Of course, they could deny the claim without the pre-authorization, but a lot of times they use that as an excuse. You didn't get pre-authorization, so we're not paying for it, so they don't have to pay it out. But if it's something, you'll know whether they're planning on covering or not, and you hang on to that pre-auth because you might need that later in case something gets glitchy when claims are being processed and for some reason the claim doesn't get paid. But it at least lets you know, hopefully, that it's an approved procedure, whether it's going to apply to your deductible. I will tell you 99% of the time, if you're having a procedure, unless you have a $0 copay plan, that you have to meet a deductible before insurance is going to pay. And I've seen some insurance companies that give really good pre-authorization letters that explain to you, yes, it's covered. Here's the expected charge that the doctor said. Here's what we will pay. Here's what's allowed, and here's what will be paid. Here's your deductible, all that stuff. So that's very helpful to you. So I think it's very important before any kind of routine thing or a sick visit that you get a pre-authorization. At the very least, have your doctor call and confirm with the insurance company if a pre-authorization is actually required, because that can save you a lot of headache in the long run, especially, and just take notes Sorry, keep track. If you let the doctor's office know they needed to call, this way if they try to come back at you with a big bill, said, why did you not get this pre-authorized? You can put it back on them and, tell them you're not going to pay the bill because they didn't get the pre-authorization and it would have been covered. Fun facts. So as we're getting closer, school is in session for some people, but back to school is a thing. We're heading into fourth quarter, so there's going to be a lot more information I'll be sharing as I'm learning stuff about all the changes. So be on the lookout for that. Until next week, peace out.